Good evening, everyone. Can everyone hear me? Just give me a thumbs up. All right. Good evening, everyone. My name is Annette Smith. I am the PAMI Advisory Council chairperson, and I welcome everyone here tonight. I thank you guys who are on and listening tonight. I hope you'll be able to really enjoy what we have to offer you tonight. We're here to hopefully give some very valuable information on coping with COVID, with the mental health and social isolation in the time of COVID-19. This presentation is presented by the PAMI Advisory Council, also known as the PAC to Disability Rights Florida. Again, I'm Annette Smith. I am the PAC chair. We have with you also tonight Daima Chin. She is a PAC member. Hello, Daima. We have Shira Collins, another PAC member. She will be presenting as well. And then last but not least, we have Catherine Strobach. She's the Disability Rights Florida attorney and on the investigation team. So I'm going to go through just a little bit of housekeeping. The presenters, as you know, just keep your mics muted, please, until it's your time to speak. And also, I will be going through a few slides, just giving some background information on the PAMI Advisory Council and disability rights. Please do not feel like you have to take any notes because we will have this information. The slides will be available and you can access it on our website. And we will also do a Q&A at the end of the session so that if you have a question while any of the presenters are speaking, you can go ahead and type it in the chat and then we will go through that Q&A and answer those questions as best as we can tonight. So right now I'm going to go ahead and get started. Again, like I said, I'm just going to give some background information on disability rights and the PAMI Advisory Council. All right, Don, you can go ahead and put that slide up for me. Okay, just a minute. We look like we're having some little bit of difficulty. You can't get it there, huh, Don? Okay, so what I'm going to do, I'm just going to go ahead and go through the slides. I do have the slides here anyway. So as I said, this is for coping with COVID, and we are Disability Rights Florida, and I'm also with the PAC, PAMI Advisory Council. The Disability Rights Florida advocates, educates, investigates, and litigates to protect and advance the rights, dignity, equal opportunity, self-determination, and choices for all people with disability rights. So in 1975, Congress created a system which is known as Protection and Advocacy Agencies to protect the rights of people with disabilities. And Congress mandated that every United States and territory have an official protection and advocacy agency. So Disability Rights Florida is the P&A system for our state. So why do we need a P&A? We need a P&A because people with disabilities were segregated from the society, they were locked in institutions, found isolated at homes with absolutely no services, provided no education, and some were even found to be being abused, neglected, and forgotten. So the P&A was put in a system to prevent and to help people cope with in those type of situations. So the P&A, what we do is we serve individual with mental illness. We also serve people with individual with traumatic brain injury or other neurological impairment, individuals with developmental intellectual disabilities, and also individuals with physical disabilities. So some people will ask, what does the P&A do? The P&A, we can go anywhere that people with disabilities are provided with direct services. So that means we could go into facilities and be able to advocate for people in certain type of facilities around the state. The P&A have the authority to provide legal representation and advocacy services to people with disabilities. And we also help ensure that people with disabilities are treated equally with dignity and with respect. And most of all, the P&A provides free, yes, free, and confidential services. So you can call on disability rights, and we will be able to help and facilitate or advocate, and the services are absolutely free as long as you fit within whatever the P&A needs to do for your situation. So those services was provided free and confidential. The P&A is mandated to protect and advocate for the rights of people with mental illness by investigating reports of abuse and neglect in facilities and in the community. And as I told you earlier, Catherine Strobach will come to you later, and she will explain how the investigation team operates and what they do on their end when someone is called in or someone complains about something in a facility. We also receive funding under the federal grant, which is called PAIMI, to do this work. And PAIMI is the protection and advocacy for individuals with mental illness. The PAIMI Advisory Council members, which is myself and the others who are speaking here tonight, we act as the link between the P&A and the mental health community. And what that means is that we assist the P&A in identifying issues that are most important to the mental health community. We also provide feedback to the P&A staff and the board of directors to develop the annual objectives and priorities for the PAIMI program. So we pretty much are like the eyes and ears for disability rights, because we see things that's going on in individual communities, and we are able to provide feedback to the board when they come to do their objectives and the priorities, which is done annually, and then we will be able to figure out how we can meet those needs. So we also educate the public about the mission and the purpose of the P&A. So that's what we are doing pretty much here tonight, is on this platform, is educating people about what the P&A does and let them know that we're out here to help them with any issue that they may have in their community with mental illness. So tonight we're going to have one of our P&A members, our advisory members, Daima Shin. She's going to come to you and she's going to present what she knows that people need right now in this time with coping with COVID. And of course, we all are going through something right now. And we know how the stress and everything can get to just the average person. You don't have to have a mental illness to be going through what we're going through right now. So Daima, if you would just come on and just give a brief introduction about yourself, and then just give us what you have.
Thank you, Annette. I appreciate that. Thank you so much. Thank you guys for joining us tonight. We're talking about coping with COVID and mental health and social isolation in the time of COVID. This is so important to try to work on your mental health when you're going through so much right now. My name is Daima Chin. I am a licensed clinical social worker. I am the owner of Miami Gardens Private Practice, and we want to talk to you today about what is quarantine. So quarantine helps prevent spread of disease that can be occurred if a person knows they're sick or they're infected with the virus without feeling symptoms. So that's what quarantine is. Okay, so now we're going to talk about isolation versus loneliness. So how do you distinguish the two? So loneliness is a person's needs may not be met, and they can be completely isolated by others and feel completely lonely. Isolation is being physically separated from others, and a person can be physically isolated but not lonely. That's a difference. Effects of quarantine. So the quarantine can have several different effects, like it could be positive or negative. So today we're going to come with a couple of effects that happens when you are quarantined. So you might have anxiety, low mood, depression. You might have symptoms related to post-traumatic stress disorders. Isolation can be found with if you get infected by the disease. The stress associated with families that have the virus, the family members having the virus, grief of loved ones who have the virus, loss of income, housing, or food. And it really causes strains on parents. Sometimes parents have issues with childcare, taking care of their kids because this quarantine, school is not open. So then that's another stress that we have to deal with. Challenges that might affect patients with existing mental health issues. Longer duration of quarantine has been associated with post-traumatic stress disorder, avoidance behavior, and anger. These are things that come out when quarantine is because they feel so not able to do what they usually would do. So this kind of messes up your norm. So you always have like a normal pattern that you usually have. And then when the quarantine, it just shifts everything to a different level. So as usually people are frustrated, they usually don't go out in public. They usually have inadequate supplies of healthcare, and they have a stigma related to it, rejection from others, bored, usually a sense of, like I said, isolation from the world. And then of course, they might have, they don't want to infect the fear of affecting everybody else around you. So that fear plays a big factor. Another issue that is a major issue right now, which is financial loss. A lot of people are losing money, whether it be in the stock market, whether it be they can't work, or they're unemployed because of this COVID. So this has been a serious distress for certain people that causes negative psychological symptoms such as sometimes sadness or anger or anxiety. It could be a number of things. Having to depend on family members for financial support, it kind of like a burden. So this has been a definitely conflicting factors that deals with PTSD or depression. So you want to talk about maybe getting you some help for it. How can I help you? So this is one family members and friends and caregivers and loved ones always say, how can I help you? These are ways that you can help your loved ones when you see them going through this quarantine and feeling maybe like isolating themselves and being lonely. And one thing you want to do is check on them regular. So I would say try to use some kind of connections, whether it be telephone, text message, social media. Check on them regular. They want to know that somebody cares about them. So that's one thing I would definitely do. Another one is empathize on stress reaction. You want to see how are they reacting to the stress. Are they acting negative? Are they positive? What kind of coping skills are they really using? The next one is help identify coping with distress. So you want to make sure you're identifying what skills they're using to cope with the distress. Coping skills. This is my favorite one of all. What do you do? So everybody says, what do you do? So what I suggest all my clients do is use your coping skills. Practice deep breathing, calming exercises, maybe some meditation, get some exercising going. You can do yoga, you can do music. I usually try to tell all my clients, get a favorite playlist and put all the songs that you really love that make you really feel good and really happy and dance to it. Just have like a jam session. You could always write in a journal, like make a diary. You want to think about maybe even coloring. People say, oh, it's for little kids. No, it actually helps you when you use different colors and color, and you see that. Another thing I was thinking about is puzzles. Puzzles are great to keep your mind going. So you can have little scrap puzzles to do and stuff. It's really helping. So you want to make sure you're engaging your friends and family in rewarding activities, something to make them happy. Volunteering using safety measures. So make sure you're wearing your mask, your hand sanitize your hands, you're washing your hands. So you want to just protect yourself at the same time. Tips to reduce negative consequences associated with social isolation during COVID-19. You want to maintain some kind of routine. So if you're used to getting up, eating breakfast, maybe getting on your computer and then doing something else and just doing a whole plethora of things, I don't want that to change. You want to make sure you're trying to keep some kind of routine. So making sure you're eating breakfast, maybe moving away from the computer for lunch, maybe getting some exercise in, breathing some fresh air. So you want to maintain some kind of routine. You want to be positive. And I usually write myself little positive sticky notes on like little sticky pads like this. And I write my little positive affirmations and sticky notes like that. You want to be able to breathe, take your time, take your breath, breathe. You want to meditate. You want to figure out what really matters in life. So I always tell myself 1 minute of gratitude. It doesn't have to be a long meditation, just a minute of gratitude. You want to limit your screen time when it comes to news because it could have some negative consequences to you. So you want to make sure that you're limiting your screen time when it comes to news. Also, you want to stay connected with your family. So whether it be social media or FaceTime or telephone, figure out a way to stay connected with your family. This is very important. If you feel like you just really can't, out of everything I told you, you really can't do it, you want to make sure you're seeking professional help. Please, please, please don't be afraid to ask for help. Help is out there. Don't be afraid of it. You want to make sure that you're utilizing your coping skills too. Things to look out for. So if you're a loved one or a caregiver caring for somebody else, these are things that you want to make sure you look out for. You want to make sure you're looking out for them taking alcohol just to relax. That's one thing, or any kind of drug at that matter. You want to protect them from excessive exposure from the news because it kind of messes up with their sleeping habits, especially if they watch the news like at 10 o'clock at night. So you want to pay attention to that. You want to think about their extreme ways of thinking. So it's like everything is bad. The world is bad. No, we don't want to think like that. We want to see the silver lining in things. You want to think about the changes in their mood. So if it's going up or down, you want to see if changes in their appetite. Are they eating too much or are they not eating enough? So these are things you want to look out for, especially with sleep. With sleep is very, very important. If they're used to getting 8 hours of sleep and now they're only sleeping 2 hours, you want to figure out what's messing with their sleeping habits and maybe go to the doctor to figure it out. What are some things to avoid during quarantine? So we told you things we want you to do. Now these are some things we don't want to have a negative impact on you. So limit watching TV, limiting your reading. I know it's good to read, but you want to limit it. Listening to certain things that might cause you trigger and remind you of something in your past. We want you to stay connected in social media, but not use it all day. We don't want you using it for 8 hours a day because sometimes it becomes hard on you and heavy on you. So we don't want you to do that. We want you to introduce activities to include self-care. We want you to take care of yourself. So whether it be like, I'm going to take an hour to paint my nails or either take a bubble bath or just to do my hair or, take care of yourself. Put that in your self-care routine, something to help you out to balance your daily schedule that you do have. Resources. So this is the part where if you have a chance, then this is resources that you can definitely use that's out there. The CDC is great to keep you up on what's going on with the quarantine, with the COVID news. If you need a COVID news, if you have issues with your mental health and you want to talk to somebody, this is definitely the 1-800 number to use. The National Suicide Hotline is a really good tool too. They're open 24 hours, so you can definitely, at 3 in the morning, if you want to make a phone call, you can definitely make a phone call. The crisis text hotline is, you can text that word hello, and they'll definitely reach back at you. If you want just to know information about COVID-19 and how to help families, FAU is a great school in Florida that can definitely have a lot of resources that you can just go in and look. If you just say, hey, I just want to know more. I don't know enough about it. I want to know more about the virus. Again, these are some mental health apps. So if you have a smartphone, pick up your phone, you can download these apps. Most of them are for free. If not, you can see which one works for you, which one doesn't. They have Calmer or Headspace, which is really good for meditation and mindfulness. So it definitely helps keep you on track which are meditation and mindfulness. They have Mood Path, which actually tracks your mood. So this says if you're doing really good or doing really bad. So it kind of gives you a say, hey, today I'm not 100. Why is that? And then you can write in your little journal and say, this is the reason why I'm feeling this way. This is how I'm feeling, and let it out, because the main thing we don't want to see happen is you leave all those feelings bottled up. So our goal is to definitely let it out. And so I tell people, figure out what way you want to do it, whether it's music, journaling, just getting out there, talking to somebody, just venting. Sometimes you just want to vent and talk to somebody. So figure out, how am I going to let those emotions out? Again, you can use this other mental health website that's really good for cognitive behavior. So cognitive is your mind. So it's some behavior exercises to see how you're feeling. So are you in a happy mood or a sad mood? What can perk your mood up a little bit today? And out of all of these, this is my favorite one, which is the Gratitude Happy Journal. So this just says all the stuff that you're grateful for. It's just a journal that you write, and it has affirmations. So it's like, I am great today. I know I'm enough. I know I can do this. You will get through it. So this is a perfect thing. If you just want to say, hey, I am grateful for being here. I want to get help, and this is how I want to shoot as my outlet. This is a perfect outlet to do it.
Thank you, Daima. That was awesome, awesome, awesome. Thank you for all that information. One of my favorite is meditation. I make sure I do that every morning, and I have a sleep meditation at night. So it does work. I mean, those resources are awesome. And I just want to just stop briefly also to thank our ASL interpreter for tonight. To be on and help us with this webinar. We really, really appreciate you guys. And if you happen to just be jumping on the webinar, you may have missed that I did say that you can put a question in the chat, and at the end of this webinar, we will answer those questions if we have any and try to get you the information that you need. So moving on, we're going to bring on Shira Collins. And Shira is going to give us some very good information on virtual peer support during this time. Shira, if you could just briefly introduce yourself and then go along with your presentation for us. Thank you.
Sure, thank you. Hi, I'm Shira Collins. I'm also a member of the PAC. I am someone with lived experience of mental illness and psychiatric disability, and I've also worked in peer support. So this has definitely been a difficult time. I've experienced a lot of the effects of COVID that Daima just went over. And peer support is something that's really helped me get through this time. It definitely has been isolating, and for me, peer support is a really good way to stay connected to people who are experiencing similar things, who really get it, who get what it's like to both be dealing with psychiatric disability and be dealing with the effects of COVID at the same time. And it's really great that a lot of peer support services have transitioned to virtual during this time to kind of still be available. So I just wanted to briefly go over some of the services that are available. So there's a peer respite in Gainesville, Florida. Typically, in-person peer respites are short-term voluntary crisis houses where people can kind of seek services from staff members with lived experience. It's a really good alternative to psychiatric hospitalization or kind of other more medical interventions. Right now, obviously, it's pretty difficult to offer in-person services, so they've transitioned to providing respite and care online. So there's a number of online groups, and they're also offering phone support via Warmline. So you can find out kind of what those groups are on their website right there. There's also a peer-run organization in Orlando called Peer Support Space of Orlando. And right now they're offering online check-ins, game and activity nights, and virtual support groups for different topics and issues, including parenting, self-care, autism, and LGBTQ identities. There's also a lot of local NAMI and DBSA affiliates. That's the National Alliance for Mental Illness and the Depression Bipolar Support Alliance. They have really great peer support groups in person, but right now a lot of them are online. So you can check kind of wherever your local one is. That will most likely be meeting via Zoom or by phone. There's an organization called the Western Massachusetts Recovery Learning Community. That's a peer-run organization and an advocacy organization that does work kind of nationwide to provide trainings and support groups in different kind of alternative models of care. And they have a comprehensive listing of national virtual peer support groups. So yeah, that was on the previous slide. That same organization has a peer support Discord server. If you're not familiar with Discord, it's like a group of chat rooms basically that's organized by different topics. So you can communicate either synchronously or asynchronously, and that is available to people all over the country. That's the link to join. That's something that's personally been really helpful to me because they have so many different kind of chats and discussions going on. So pretty much at any time I've gone on at 3 a.m. sometimes because sleep is hard during a pandemic. And I've just been like, is anyone available? Anyone else having trouble sleeping? And I've gotten responses, and we've kind of had a little peer support chat party. So I highly recommend that one. Purely Human is another organization that offers virtual peer support groups for suicide, coping with stress, and healing from trauma. And that organization has actually been offering virtual peer support groups since before COVID. So that's really good for kind of if you're looking for somewhere that has peer support consistently, even not during COVID. And then finally, there's a virtual meal support account on Instagram. It's COVID-19 eating support. And they offer free meal support for people with eating disorders or disordered eating. Basically, a dietitian or therapist with their own lived experience will kind of just guide people through meals and create kind of a communal experience around eating so that people aren't so isolated when trying to meet their dietary needs. So yeah, thank you so much. And now I'll turn it over to Catherine.
Thank you, Shira, for all that information. That is a lot of different variety of peer support. I guess, like they say, get in where you fit in, and you definitely can get in where you fit in with all those different areas that you gave. So it seems like it has different one for different type of behavior. So thank you for all that information, and we will move on to Catherine Strobach, and she will be giving us the information that we need to talk about our investigation and legal team.
Thank you so much, Annette and Shira and Daima. We are so lucky to have you and the rest of our PAIMI Advisory Council supporting us and helping us make sure that we're doing the best we can for the mental health community. And again, my name is Catherine Strobach. I'm an attorney here at Disability Rights Florida with the investigations team. And we work primarily with individuals with mental illness who reside in facilities or who are recently discharged from facilities and require our assistance. So, the types of information that we provide come in the form of information or referrals. This is maybe you're just looking for resources, kind of like the ones that Shira and Daima just provided. Or maybe resources that are particular to your community. You can contact us and we will do our best to assist you and get you to the best sources of information or support that you could possibly need. Other ways that we provide assistance to individuals with mental illness comes in the form of self-advocacy support and technical assistance. And these are things that we do to provide you with information and equip you with all the resources that you need to advocate for yourself. If you are somebody who is experiencing abuse or neglect, or your rights are being violated, we are also here for you. And we do on-the-ground investigations to determine if these things are in fact happening and advocate for you to help keep you safe and maximize your treatment and your potential. Other things that we do are negotiation and mediation support and even legal advice and representation if you have a situation or a case that requires it. So the places that we cover a wide variety of facilities as well as the community when we're serving individuals with mental illness. And the types of inpatient treatment facilities that we cover include places like crisis stabilization units or Baker Act facilities, all of the state hospitals, whether they're public or private, and then a variety of congregate care facilities that are more community-based, but still, they're the types of places where you definitely have rights. And these include places like nursing homes, assisted living facilities, jails and prisons, homeless shelters, and also for individuals living in the community. If you've been recently discharged from any of the above facilities, we are here to support you. And we have access to all of these places in order to make sure that we can talk to you and help you in whatever it is your request for service might be from us. So how do we do these things? Well, one of the ways that we help protect individuals in our community with mental illness include doing investigations of abuse and neglect in facilities. So these are the types of investigations that we do when an individual contacts us or a family member contacts us with a concern about the way they are being treated in a facility. We also do the same thing when it comes to rights violations. Now, rights violations are a little different, and it could be something like maybe you don't have an individualized treatment plan, or maybe you don't feel that you are being involved enough in the development of your treatment plan. Maybe you have questions about whether or not you have to take medications, those sorts of things. So if individuals call us and they want us to investigate abuse, neglect, or rights violations, we are here to do that. And the way that we do that is by talking to you. We talk to facility staff. We can review your records only if you give us permission to do so, and talk to anybody else that we need to in order to assist you and help keep you safe and make sure your rights are protected. Another way that we protect your rights and assist people is by monitoring these facilities. When we monitor facilities, that means that we haven't necessarily received some sort of individual complaint or concern, but we are going to go into a facility and we're going to look around and we're going to make sure it's a safe environment and get to know the staff there. So that if we ever do get a call there in the future, we have contacts and we're familiar with the place. And then finally, one of the ways that we help individuals is with legal representation. When we have cases or there might be arbitration or mediation or some sort of other legal method where we enforce your rights and protections as they're granted under the laws of our nation as well as our state. So how do you request our services? Well, we are a no wrong door agency. So that means that any way that you try to reach out to us, somebody is going to try to assist you and make sure you talk to the right person at Disability Rights Florida to assist you. But the phone number for you to call is 1-800-342-0823. And the thing that I would like to tell everybody listening tonight is that if you are an individual or you have a family that is an inpatient in a facility and is not able to access a computer or another way to get in touch with us, we have a special intake line devoted to you. And that's a top number on the screen. And that's extension 3, and it's available during all of our open office hours. If you are in the community, it's the same phone number, but we also have another extension where we can take your call, or you can contact us online if you have access to a computer and put in a request for service that way. So when you call, we try to make our intake procedure as simple as possible. So you don't need a lot of information, but the most important information we're going to need to know is who you are and how we can get in touch with you and exactly what kind of help you need. So when you call, and this is especially true if you're calling from a facility or on behalf of someone in a facility, if you have identifying information for that person and can provide us exact information as to where they are in terms of either a patient identifier number, a unit or a room number, or a phone number for a trusted contact in the facility, that would be extremely helpful to us in terms of being able to get to you or get to your loved one quickly and easily. We do ask you questions because our federal grant funders do require us to ask you questions about the nature of your mental illness. We'll ask you basic demographic information as well to help us identify you and make sure that you are the person that we are looking for when we go to investigate. And then the last things that you need are either tell us what it is you need help with or what information you're looking for. And if you have a legal issue and you have documents that you want us to look for, if you can have those available or tell us who has them available for us to review, that would also be very helpful. So I hope that what you gather from this is that it is actually very quick and easy intake process in terms of when you call, and this is all the information that you'll need for us to be able to help you. If you would like to get involved with the work that we're doing here at Disability Rights Florida or with our PAIMI Advisory Council, we actually have a lot of different opportunities for you. You can apply to be on our PAIMI Advisory Council and join Annette and Shira and Daima in helping us. There are links on our website where you can do that. Also, you can apply to be on our board of directors. Another option is to help host an event. We are available to do presentations like this on a variety of topics. Very popular right now are the Access the Vote presentations, where we talk to you all about how to make sure you are able to fully exercise your right to vote. We have presentations designed just on general information about our agency and what we do. And we're also even happy to work with you to develop or tailor something specific to your agency or your needs. If you would like to join a coalition, we have a very active coalition on supported decision making, and we would welcome your input in that particular project as well, if that's of interest to you. We always love to hear from you on social media, and we try to provide lots of good resources and tips and information through all of our social media. And you can find us on Facebook, Twitter, YouTube, Instagram. In terms of resources, we have a lot of free videos that you can watch on different topics, and you can get lots of great information from any of our social media resources. And you can also share your thoughts and engage with others who might have similar thoughts or questions. Another thing you can do is please, and I hope everybody watching our presentation goes to our website and joins our mailing list. You will get a newsletter emailed out to you, and it has lots of great resources as well as links to all of the above resources. Finally, we would really, really love to hear from you. One of the things that is so important to us is making sure that we are serving the community as best as we can, and that means we need your input to do that. If you or a loved one is residing in a facility during especially this time of COVID and you have concerns about their care or their treatment, we have a specific survey designed to collect information on that. And then we also have an annual survey Our annual input survey is statewide, and we take information from anybody that wants to give it to us in terms of what they feel we should be doing as an agency to help set our goals, priorities, and objectives and make sure we are providing the services that you need. This is our contact information. This is for our main office in Tallahassee. We do have offices all around the state, also located in Gainesville, Tampa, and Hollywood. But this is our main office, so please feel free to write to us there. And then our phone numbers are also available. The main phone number again is 1-800-342-0823. And the TDD number is 1-800-346-4127. And you can also visit us online at disabilityrightsflorida.org. If you have any questions at all about today's presentation, or you want to reach out to any members of our PAC and get information from us, there's an email address for you to do that at pacevent@disabilityrightsflorida.org. We are going to put our presentation on our website, available for anybody to look at, so all these links will be available to you. It's going to be on the section of our website that deals with our PAIMI Advisory Council, and I hope that everybody has the opportunity to download it, keep a copy, and please definitely engage with us, fill out a survey, join our social media. We want you to be part of our community. And thanks to Daima, at the very end of this presentation is also an additional list of resources. So everything we presented to you tonight has been evidence-based, and you can review these resources at your leisure and ask us questions about these as well. So thank you again very much to our advisory council for doing this presentation with us, and thank you also to everybody that's joined us this evening. And I think now we're ready to take questions if we have anything that anybody wants to ask the presenters.
We do have one, well, two questions actually. One from Brenda, Support Independent Living. She wants to know how to ensure that things will return to normal and that there is light at the end of the tunnel.
You want to take that, Catherine?
I can try.
Actually, I would like for Daima to just kind of give what you think as far as, dealing with this and the mindset of people right now. What would you say to Brenda, you said, to help her, just to get through it?
Thank you, Brenda. Great question. Unfortunately, I don't know the answer to that question. Unfortunately, I don't know who knows the answer to that question. But what we do is can heal each other from the inside. So I don't know. I can't worry about what's going on the outside. I can only focus on what's going on the inside. So what you can do is work on how to help yourself from the inside, which is, like we told you before, the coping skills. The coping skills will definitely help you out. So when you do feel your mood kind of like, I don't know, or feeling really anxious about the future, because sometimes with fear, we get kind of anxious because we don't know what the next day to predict, or will it ever go back the same way? We don't know. So what we have to do is something called like roll with the punches. We have to figure it out. But mentally, you want to make sure you're taking care of yourself, taking care of your well-being, taking care of your family. You want to make sure everybody's okay. So for the real answer that I have, I don't have an answer because I don't know when it's going to get better, but we know we can work on you, and you working on you is probably the best thing that you can do.
Okay. Brenda has another question, and she is stating, what is done if people call all the time and are not truthful?
Are you, I guess I'm going to assume, maybe calling our agency for assistance and maybe not providing accurate information? Well, I can say that what we do here as an agency when we receive information is we definitely always check it out. We do investigate. And so we're not an official government agency. So there's no consequences if somebody calls us and gives inaccurate information. Like, we're not the police. We're not going to get you in trouble if something turns out to not be true or not be verified. I think that we just try to be very careful to make sure that we're working with accurate information before we take any sort of formal action. But I'm not sure completely if that answers the question. So I don't know if maybe Brenda can give us some more information by email and we can try to assist her. But, you know, again, we are a nonprofit organization. We are not a government agency. So we receive the information and we treat it confidentially, no matter who's calling, and, you know, try to handle it appropriately as best we can, and definitely verify everything that we receive before we take any sort of official or, I guess, legal action. I hope that helps, and I don't know if anybody else has anything to add.
I wanted to, not to that question, but to bring the other question about having light at the end of the tunnel. And I guess, Shira, you probably can chime in on this, because I would think that some of the peer support groups that you listed would probably be something good that Brenda could look into, just to speak with other peers who feel the same way.
Yeah, I absolutely think so. I think none of us are really sure what's going to happen or how long this is going to last, but just to know that there are others who are feeling that uncertainty and feeling that anxiety about how can we go on, that's something that really, for me, just helps me feel less alone. So I think peer support can be really helpful for that.
There is a comment from Fritz, says yoga is a great one. So he likes the yoga. And those are all the comments and questions that are on here right now.
Okay, great. Oh, if you have any other questions, all the information is given to you as far as how to get in touch with us. And when you're looking at this, maybe on replay, if you have any questions, just feel free to reach out to us. And please follow us on our social medias, platforms, and on our website to see what other events we have going on and other information that you can get, because we do have a vast amount of resource for you, and you can call in and get any information you need. We really want you to just really use us, because we are here for you. If anyone else have anything else they want to say last minute before we end? Everyone is good? Okay. So we thank you again. We appreciate you showing up tonight to listen, and hope that you will share this with others so that they can play it on replay, and reach out to us whenever you need any assistance. And just tell your friends about Disability Rights Florida as well. You could be advocating for someone on someone else's behalf as well. So just please contact us if you need us. And we really thank you for being here. We appreciate you. Daima, I appreciate you. Shira and Catherine, thank you guys for just being here tonight and sharing all the information you have. I really appreciate you guys. And Dawn, thank you as well for being here with us tonight. And we just thank everybody for coming out, and everyone, please stay safe. Please keep your mask on when you go out in public, and stay safe, and try to stay as calm as possible in these times. Thank you, guys.